I'm sure some of you know that Foothold has been a national partner of Anchor for many years and also provides support for many Anchor activities throughout the year, including being a sponsor of the Policy Summit. A lot of you might know Elliot Masuda at Foothold. He's usually the face of Foothold, and he is on paternity leave with a beautiful baby. But so pleased that, and Elliot said the last few months, we've had the pleasure of working with Jim. Jim beautifully represented Foothold a few weeks ago at our conference in Chicago. There's so much we could say about data. We could say it's the future technology of the IDD community, particularly in the realm of AI discussions. But I'm going to stop because I can get on my soapbox, and we're going to hear from the experts, and delighted that an Anchor member is part of this discussion with Foothold. So I welcome and thank Amy, Adam, and Jim, and look forward to this wonderful session. And thank you so much for your support.
Awesome. Thank you, Mariana. I appreciate it. And without further ado, we have our two superstars from AccessCNY, Amy Els. Did I say Amy Els and Adam Soper? So Amy, maybe we'll start with you. Maybe just give us a little brief introduction and what you do there, et cetera.
Sure, thanks. So like Jim said, I'm Amy Els. I'm the Associate Executive Director of Quality and Performance at AccessCNY. I've been there, been here for just about 6 years now. And just to give you a little overview of our agency. So our mission is to offer person-centered services that empower individuals of all ages and abilities to reach their full potential as part of our shared community. Our services are provided with dedication, compassion, innovation, and commitment. And so the services that we provide are pretty diverse. So we offer many OPWDD services, including residential IRAs, community habilitation, day habilitation, self-direction, supported employment, and a variety of others. We have mental health services, residential treatment apartments, peer crisis respite services. We have consumer-directed personal services through the Department of Health waiver. We have a clinic that offers OT, PT, speech, and different day programs, both OPWDD and the TBI waiver. So we do a variety of things, and we use Foothold for our mental health services and our OPWDD residential services. And I'll let Adam introduce himself.
Hello, I'm Adam Soper. I'm the Director of IT and Data Analytics at AccessCNY. I've been here just a little over 3 years now. Primarily, my role was to be kind of the data guy, build a data warehouse, pull all of our different systems data together, combine everything. It's kind of split now between IT and data, but we've come a long way with data as far as our data warehouse and kind of getting all our systems data in one place and being able to see it all in one place. But we'll dig into more than that as we go through things.
Awesome, thank you. So just a quick overview of how we're running this today. We don't have a quote unquote formal presentation for you. So this is definitely an interactive Q&A. So you can see our agenda here. We did our welcome and introduction and panels introductions. And so we're going to jump to the conversation part, and really we'll start out with the question of, why is data so important to your organization?
Sure. So we feel that data provides us a way for all levels of the organization to analyze our performance and make better informed business decisions. We feel like it allows us to set goals and then measure against them to see if we're improving or if there's areas that we need to keep working on. It allows our programs to take some accountability and ownership and pride in the work they're doing, right? So it's a way to easily show the work for all levels of the organization. Data helps us all be on the same page, right? So you can anecdotally talk about things, but when you have data and numbers in front of you, everyone is clear and on the same page and has a shared vision. We feel data is important at every level of the organization, from our director staff up to our board of directors. All have different data points that they're looking at. Data is really important to us as we prepare and continue to prepare for managed care. Having data readily available to show how we're performing as an agency is important. And as we become more involved in local IPAs and with other organizations, they're now requiring us to report on specific data points. Personally speaking, so one of my roles here at Access is the compliance officer. So Adam has been great in helping pull data for me to look at data points and see again where some areas of concern are, or areas or programs that are really thriving. We've used it to help measure productivity and, like I said, compliance. And we've also done some work to identify participants who are at high risk for certain diseases, and we can track them more carefully.
Great. Adam, I don't know if you want to add in or have anything else.
Yeah, I think she covered it on that part.
Awesome. So, as you look at systems and systems like Foothold Award, things like that, like what role do you see those, EHR case management kind of playing in as you kind of move through this process?
Yeah, so basically, like specifically to awards, like obviously, like Amy mentioned, it houses our OPWDD residential and our mental health programs. So, high level, it's the system that captures all the data elements we need in order to bill. So because of that, we're able to pull those elements out and create reports on it and, use meaningful measures to kind of track our effectiveness. That could be anything from like unit utilization, amount of services we're providing over a given period of time, program compliance, staff productivity, staffing levels. And awards has been nice because the reports are pretty customizable in there. So we can create our own reports that are going to capture all the elements we might need in order to extract it. Otherwise, extracting data is a time-consuming process. So in order to create a customized report, it's been very helpful. And awards also has the ability to track elements outside of what we need in order to bill. So if we want to track things like additional diagnosis or how many provider appointments somebody's had, follow-up visits, primary care physicians, we're tracking things like A1C testing and other medical testing. So the ability to do that all in one system has been really helpful.
That's great.
Yeah, and I would just add, I think the benefit of awards versus a spreadsheet, right? We can require certain fields, and therefore staff have to fill them in, so we can get that data out. So that's been helpful.
That's great. And just OPWDD, I know some folks may not be in New York, so maybe just a quick clarification on who they are, what they do, just so everyone knows.
Sure, sorry. OPWDD is the Office of People with Developmental Disabilities. So they're the state oversight agency for our participants with an intellectual and developmental disability.
Got it. Awesome. Thank you. So as you think about your agency, pre-awards or pre-data centric, if you will, and how would you describe this, prioritization of data, like really kind of almost a data culture is some of the language we've used in the past. Like what does it what's a before and after kind of picture look like?
Yeah, sure. I would say before, we were guessing. There's a lot of guesswork, right? You create your own stories, your own narrative to kind of match what you think is happening or what you hope is happening. And we have found that by prioritizing data and really analyzing it, that takes the subjective piece away and it's much more objective. I think Adam can attest to, sometimes we put the data in front of people and they're like, no, and yeah. Yes, and that can be good or bad, right? Normally when it's not going the way they want, there's a lot of questions. So that has been helpful. We're looking at something objective. And again, we're all looking at the same data. It has really helped with some productivity. So we have a community habilitation program. So that is staff typically working one-on-one out in the community. with participants. And so our billing is based off 15-minute unit increments. So it's really important that we maximize that. And so we're able to show the program people, look, we bill in 15-minute increments, but you stopped billing at 14 minutes. So we got nothing. We did not get a unit of billing, and we can train and educate people around those data points. I would say before this also, we lacked consistency. We did not have data governance. And so, you know, one program had something in mind that they thought was important to capture. And so we wanted to have some consistent data points across all programs. And even helping programs see how the work that they're doing can impact other programs in the agency. I think our programs can operate in silos. And so when we're able to share data, it helps bring to light really how you can impact and help out your fellow coworkers. A huge piece, I would say, before we were doing this is just the lack of efficiency, right? Really, really time consuming. If our board of directors wanted to know something, what's your occupancy rate? That was labor intensive, very labor intensive for any of those types of questions. And now it's at our fingertips. We've been able to create dashboards so we can pull it up anytime. And that has, we've seen a huge improvement there. The other huge part, probably the most important part about where we were before this, is we didn't have Adam. So I tell everybody needs an Adam. You can't have ours, but it's really important to have someone who is knowledgeable and can help lead and facilitate this work.
Great. So in relation to that, and I think we'll share that slide as well. Can you walk us through sort of your internal process around data decision making and things like that? And I'm going to throw a curveball question at you too, because this was asked. I know we had done this a little bit before, but someone asked about, you know, how do you handle some of the change management techniques as you kind of go through this? Because I know that was a big, you know, people think they're data driven and all that, but there's obviously some change management to that.
Yep. Yeah, so basically following along with this slide, like the first step, you know, is what's the need? You know, where's the need coming from? You know, the question, is it coming internally, externally? Like who's our audience going to be? And that's going to kind of drive everything else a little bit different ways. So, I mean, once we know the question or the need, then we need to make sure we understand the need, and then start looking at our data. So we develop the measures in order to answer the question, and that'll kind of dictate what data we need to pull. And then we need to look at our data and be like, do we have it? Do we not have it? And if we have it, like what state is it in? Is it accurate? Is it, you know, are we missing a lot of it? Do we need to fix it up at all? So that's always a big piece with us. It's getting better, definitely, but at the start, that was the biggest thing, like Amy mentioned before, like data governance. It's always a challenge, but we've come a long way in that just by putting data in front of people and having people rely on it. But after we get our data sources, you know, then we organize it, pull it all together, and then it's time to analyze it. And that's when we'll put it in front of the users. And that's what, you know, Amy kind of mentioned, you know, the shocked, this isn't right, or this can't be right. So sometimes there's a realization like, no, this is actually happening. What can we do to fix it? And that's where we start looking at, you know, if we change A, what happens to B? So that's been really helpful with all this. And then that's when we draw conclusions like, you know, what can we do going forward and how can we affect this data in a more positive way?
Got it. And just as you've kind of gone through that process, what's been some of the change management pieces or techniques that you've done? I mean, you mentioned putting in front of people as one, but is any other components?
I mean, we definitely need to train them on what the data means. It depends on how we're displaying it to them. There's always training around how to use the tools we use to show our data, which is Power BI, just how it all works, what the visuals mean. And then, you know, also with change management, we might be changing the way they're collecting data. So we need to train them on that. too as well, especially if we're doing it across multiple programs and systems that we have. It might be a little different in each system.
And explaining the why, right? I think everybody can relate to that staff member who isn't going to just do something willingly. They want to ask, well, why? Why do I have to change my process? And helping them understand that. The move to managed care is hard for some people to grasp, right? They've been doing fee for service day by day. I'm going and doing my job. Why do I need to worry about health outcomes when that's not in the care plan that I'm working at? So that is a challenge, and continuing education around that as well.
That's great. That's great. Again, folks, if you want to put in something, question in chat, let us know. We'll keep an eye on that. We have a few more here for sure. So in terms of particular data units that you're tracking, like what does that look like? What does that process? And quite, if I know we talked a little earlier, you might have some examples you showed us of what that visualization part looks like.
Yep. So some of the elements, I'd say the biggest elements we're tracking are definitely billable units, and utilizing those units. Depending on the service, it could be against an authorization. So making sure we're like maximizing that authorization, or at least not going over the authorization. Another big one for us is diagnosis information. So we kind of categorize people as high risk, especially during COVID. We kind of prioritize the vaccine based off the risk factors. Also other diagnoses that we don't treat, but maybe we could help with as part of like social determinants of health. We do a lot of compliance tracking, so a lot of data points around that. Could be, note writing, signing of notes when it's happening, pulling all that into a single dashboard to call things out. I already mentioned, additional health information, like we're tracking like A1C testing, ER visits, and, everything along those lines. And I can kind of show you kind of what it looks like in the real world here. So you should be able to see my Power BI over here.
We can.
Yep. So this is basically what a report might look like coming straight out of awards. And this is all, demo data. This is nothing real. So this is kind of what the spreadsheet looks like. It has all the information, but it's hard to figure out what's going on here. So we pull it in the Power BI and we just create some measures around things. So real basic things might be, how many visits did we have, in the last 90 days? We can set a metric, like if it's over a certain amount, it's going to be red. Just at a quick glance, we know where we stand. Then we can break things down a little bit more. We can see visits by participant, what they went in for. We can see, by treatment type, what are we seeing, age groups, and also by program. Of course, we can filter by date and everything kind of on the fly. And then we can look at our trends, like what are our average visits? This quarter, are we above or below our average visits? And then we can start digging into the whys and change things to try to affect those numbers for the future quarters.
Great. Have you seen the impact from this on the organization?
So we did specifically around our ER visits. We did a study, I guess, with our MH residential, where we were actually able to reduce our visits just based on some additional training and policies.
Yeah, so we could identify those frequent flyers, right? Everybody has those folks that are constantly in the ER. And so we could do some specific training with them. We did training with staff on some interventions. One of the things we implemented, people weren't feeling well, and so maybe they lived in apartments and we weren't seeing them every day, so they were using 911 as a way to get to the hospital. So we started a corporate account with Uber, so that then our participants would know, I can reach out and get an Uber ride, and the agency will pay for that, and go see my doctor or go to an urgent care instead of the emergency room. And we were able to reduce some of those visits.
Oh, that's great. Wow, fantastic. And sorry about that. Can you talk about like some of the challenges you've kind of come across as you kind of gone through this process? Like, I know these are so, I mean, the reports are awesome and everyone goes, oh, that's great. But of course, get that journey getting there is always, there's some challenges and pitfalls. Can you talk a little bit about what those have been and how
Yeah.
you overcome them?
I think Amy's mentioned it before, but like getting staff on board to just track additional data elements, like they need to understand the why, they need to be able to see the big picture. That's always a challenge. Data governance is an ongoing challenge, just ensuring all the data is accurate. Because we offer so many services, we do have a few different systems, so the data is a little different in each system. So just making sure it's documented correctly across the board. And then just getting the agency to review the data and actually use it. That's a challenge as well. You know, once the dashboard's created, it's who's going to use it and how are they going to use it. And that really needs to be defined and kind of given responsibility to people like this is, you own this. This is what you're going to do with it. This is who you're going to notify when you see this. You really need to really define those processes out.
Right. And just kind of in that vein, like if you were talking to other providers, I'm assuming you have even talked to other providers, like what kind of advice would you give them? Like what are some tips they could walk away with, if you will?
Yeah, I would say if you're starting out from fresh with this, start small and start with something that's going to make your audience's life easier. It may not be the top thing on your priority list, but if it's something that's going to help them a little bit day to day, it's going to create the buy-in from them. So I would say definitely start with that first. And once you get there, be prepared to change it often, because once people get what they ask for, then they're going to ask for what they really need. And things change, and it could be completely opposite of what they asked for. So just be prepared for that, and try not to get frustrated, but it's a work in progress.
That's great.
Yeah, I would also
Yeah,
recommend piloting like in a few small programs, right? So you don't have to go across the whole agency at first, like dip some toes in, and then you'll find some cheerleaders, right? People who will buy into the process and are also excited about it, and can help you with this work. So I think that's always helpful.
It looks like we have a question here. So this comes in. So I'm going to just read it verbatim. So there's issues in smaller communities in both access to the internet and training our staff in order to get good data also being tracked in small communities, not as cumulative or qualitative. Any thoughts or suggestions on that?
I mean, to getting our good data, I mean, we control all the data sources, and they're all, in systems that we kind of own and operate. So I don't think internet's really an issue on our end. And getting good data is always, that falls in line with data governance. It takes a lot of training. It takes pulling the data and showing the current state of things. If we're tracking something like productivity, and you see productivity is very low, and we start digging into the data and it's because it's not being documented properly, that's a motivation for someone to start tracking it properly. So I think just getting the data out there in front of people as much as possible so they're using it. And then if it's, bad data, then they're going to see that and try to fix it.
I would also say we also have an online learning management system. And so if internet's an issue, then that would also be a struggle for staff. But we have been able to create some worksheets in the past or some guides that we can post so people can reference and know our expectations. So it's not uncommon, like with awards, with Foothold specifically, we have face sheets. And so we created expectations, like these are the required fields, make sure you fill them out, and we share that. So then people also have like a template to work off of.
That's great. Okay.
I will say too, we also have, since COVID, we have like drop-in spaces and training rooms dedicated for stuff like this as well. And we recently just created like a little computer lab, so to speak, where people kind of come in, sign out a laptop and do work in the office if they don't have access to something.
Yeah, it's good to have your champions. Like Adam certainly can't answer the question for 1,500 of our employees. So we have some people who have good knowledge and are their own experts in their program area that we encourage people to use as resources.
Great, great. Another question came in and just they were asking about what was it the process in finding a vendor to help serve your data needs? Like did you go through an RFP or what did that process look like?
So before me, I know we did work with a vendor that kind of helped start off our data warehouse. I'm not sure on the process for selecting them. They were already kind of here when I started. I don't know if you want to take that one, Amy.
Yeah, we really relied on a consultant in our selection of Power BI. So we did not do an RFP process. They had experience with some different analytics software. And so, I mean, we had some say, but we really went by what their recommendation was. And then in terms of electronic health records, we've never done an RFP process. And if anybody has a science to selecting the right one, I would love to hear it. Foothold has been great for us for several of our programs, but has not met all of our needs. And so we do have a few different vendors, and sometimes, probably more often than not, you get in and you're like, this, not quite what they promised, and you're left a little bit frustrated. So yeah, as much vetting you can do and making sure that all the right people are putting eyes on it. So your finance people, your quality people, your program people, your IT people, that everybody has a say, because we all have our own things that we're looking for in a system.
Yes, yes. Amy, I love the RFP, process. Like if you can find the perfect process, because we would love to know that too. It's amazing.
Yeah.
We could probably do another webinar on that alone.
Right.
So it's all. So I again, folks, if you have questions and you want to, we do want to keep this somewhat tight. So we're happy to finish. I have a couple more here, but put them in the chat. And I guess one of the other questions I wanted to ask you both was, I think this occurred when in some of our conversations were, what do you say to organizations that I'll use air quotes, they're already there with data management, but they're really not. They think they are. Like I know there's not necessarily a finish line per se, but how would you kind of classify? Is there any tiering you would do in terms of where folks are in their data journey, if you will?
I would say it depends on, how much data you're, I guess, using, like what kind of data elements you're using, and then how many people are accessing it and making decisions from it. And are you able to change outcomes based on the data you're using? I mean, that's pretty much the end goal, right? You want good data in, make a good decision and move forward. I mean, so I guess those are your goals.
Right.
Yeah. And I would challenge anybody who thinks they're there. I don't know that you ever can be, like, to piggyback back off what Adam said. You want to be flexible. I think all the time our funders are changing what they're asking for. And so you need a system and people who can be flexible and adjust with that. But that it's a challenge. I can't say enough about the work that Adam does and being able to extract data. So we extract data not only from Foothold and our award system, but our HR system. We're working on our billing systems, and when you can pull all of that information in and marry it's the data is so rich.
That's great. So another question again, I'm throwing some new ones at you here as well. So you mentioned earlier about data and talking to managed care and things like that. Have you ever had shown them data and had them change things, change rates, change policies, or modify them enough based on data you've shown them, or use data in those conversations?
No, I would say we're still in the infancy stages with that. So we have a few managed care contracts specifically with our consumer directed personal services, but it's pretty basic. Our work in preparing for managed care is more with the local IPAs. So as a community, we've come together and identify things like our work around the ER visits was in conjunction with our local IPA and trying to lower those numbers as a community. We're also looking right now ensuring every one of our participants has a primary care provider and working with them if they don't. And so that's another area that not all of our programs see a benefit in, right? I'm not doing healthcare with them, but understanding that if they have a primary care and good healthcare, their outcomes around everything are going to improve. So there's an education piece. The other big initiative we've had lately is around social determinants of health. So we're working with our IPs on that. So we are doing, we're providing all of our participants upon intake and then at least annually an SDOH assessment, and we're collecting that data and following up. So this is a project that is just near and dear to me because I see, in the last 6 months, we've been able to provide 80 people with some additional food resources or get them connected with housing. And so those are data points we weren't collecting before. And so I'm really excited about that and seeing the positive impact we're having in their lives. And we're talking about expanding that work to our employees as well, knowing that many of our employees are not working at much over minimum wage and probably also struggle with food insecurity or not having good health care.
That's fascinating. Yeah, that's definitely that's another topic that you cover as well.
Yeah.
So and real quick, IPAs. I could for our audience that maybe not in New York, talk a little bit what IPAs are.
Not my area of expertise. I don't know, Adam, if you feel.
So it basically stands for Independent Physicians Association, I believe. So basically, it's just a group of minded organizations that group together and take on projects. Could be data, just changing processes or whatever, in order to better the community. And then, of course, go back to the insurance companies and say, hey, we're doing this. Can we get a better rate? And they're usually funded through grants and sometimes from insurance companies.
That's perfect. Thank you. And then my last question, unless other folks want to jump in here, just sort of going forward, and I sort of give you two questions here. One is there anything we've missed that you think, hey, other folks we should talk about in terms of their current data journey? And then kind of in the future, what does that future look like for you and where you want to go and where you see data systems going in general? And those are big questions too.
I think one thing we're looking to do in the future is probably some more resources around our data collection and analytics, and also training our staff better on how to use things. We have little pockets of groups and people and programs here and there that are really into it, but we want to get more people using it more like they are, and we want them to come up with their own ideas on what they want next. We see that a little bit, but I think we can do better on that.
Yeah, I joke that Adam was our best kept secret for a couple of years, right? He started during COVID times and quietly did his work and built these amazing dashboards, but now people know about him and he's like the MVP of the agency. So he's busy. And so we are looking up at expanding our resources and providing some support to him. Yeah. The other thing I would say that this data analytics piece has given us is we are now collaborating with a few agencies. So smaller agencies who might not have the resources, we're doing some work for them. So it allows us to help them collect data and analyze it and kind of be their support system in this journey.
That's fantastic. Well, again, thank you so very much. I don't see any other questions there. I think we've gotten through all of them. Any other just final parting words or comments you want to send out there?
I would say, as wherever you are in your data journey, to celebrate the successes, right? It's important for people to feel like they're getting wins, especially the win might be that you acknowledge, an area of weakness, but now we know about it and we can address it. And so it's important for people to feel validated in that way. Because I think data is scary to people who don't understand it and they feel like it's a weapon instead of a tool. And so educating, celebrating, and really walking with people on this journey.
Fantastic.
I second that too. Like if you start pulling data and it's bad, but it's really like bad, like, that's a good thing in a way, because now and now you can fix it.
Right.
Yep, that's great. That's awesome. Well, Amy, Adam, thank you so very much. Mariana, thank you for jumping in. We really, really appreciate it. These kind of things really help the community at large in general with data and what it looks like. And I think, Amy, your point about data being scary is well noted, and we definitely see that. And seeing how folks can really leverage it is music to our ears as a data company, of course. So we love seeing and hearing these stories. But thank you very much, and thanks everyone for joining us today. Hope you learned a little something. We'll have a recording we can send out if you have other folks that you want to share that with. Feel free, and look forward to. We have another data conversation later this month. We're doing with some of our internal experts to talk about what we're doing and some of the nooks and crannies on that side of it. So thanks again, and have a great day.